people have contracted the infection so far globally. Modi government's top priority is on early case detection and saving lives. According to the Health Ministry, 11 most COVID-19 affected countries in the world, the US, Brazil, Russia, Peru, Chile, Mexico, South Africa, the UK, Iran, Pakistan, Spain together reported 8 times more cases and 14 times more deaths than India. The focus of containment strategy remains on house-to-house survey, perimeter control activities, timely contact tracing, surveillance of containment and buffer zones, aided by effective clinical management of severe cases through a standard of care approach. Continuously expanding hospital infrastructure has aided in increased recoveries. The latest testing strategy of ICMR allows all registered medical practitioners to recommend testing. The focused efforts of centre and state and union territory governments on efficient clinical management of hospitalized cases has ensured that India's case fatality rate has fallen below 2.5%. With effective containment strategy, aggressive testing, and standardized clinical management protocols based on holistic standard of care approach, the case fatality rate is progressively falling and currently it is 2.49%. India has one of the lowest fatality rates in the world. Under the guidance of the centre, the state and union territory governments have ramped up testing and hospital infrastructure by combining public and private sector efforts. Many states have conducted population surveys to map and identify the vulnerable population, like the elderly pregnant women and those with comorbidities. This, with the help of technological solutions like mobile apps, has ensured keeping the high-risk population under continuous observation, thus aiding early identification, timely clinical treatment, and reducing fatalities. At the ground level, frontline health workers like Ashas and Anganwadi workers have done a commendable job of managing the migrant population and enhancing awareness at the community level. As a result, there are 29 states and union territories with CFR lower than the India average. 5 states and union territories have a CFR of 0. 14 states and union territories have a CFR of less than 1%. This shows commendable work done by public health apparatus of the country. With Bihar seeing a spike in the number of COVID-19 cases, a 3-member team of experts from Delhi visited the state to take stock of the situation. The Union Health Ministry's multidisciplinary team, headed by its Joint Secretary Love Agarwal, reviewed and coordinated with State Health Department in managing the outbreak in the state.
पटना में जैसा आपको पता है कि 25 अस्पतालों में और 5 मोबाइल मेडिकल टीम्स के द्वारा ये स्टार्ट किया गया है और कल 500 से अधिक लोगों की स्क्रीनिंग हुई और 100 से अधिक लोगों का टेस्ट भी किया गया पटना में और सभी जिलों में इस तरह की व्यवस्था की जा रही है। तो ये जो टेस्टिंग किट्स और स्पेशली एंटीजन टेस्ट के लिए किट्स पर्याप्त मात्रा में उपलब्ध करा दी गई हैं कि जो भी सिम्टोमेटिक लोग हैं वो जहां चाहेंगे, जिस जिले में चाहेंगे, अपने अगल-बगल के स्वास्थ्य संस्थान में टेस्ट करा पाएंगे।
On Sunday, Minister for Health and Family Welfare Dr. Harshvardhan inaugurated a plasma donation campaign jointly organized by Delhi Police at AIIMS in New Delhi. Meanwhile, All India Institute of Medical Sciences will conduct human clinical trials of the indigenously developed COVID-19 vaccine candidate Covaxin from Monday. 100 volunteers between 18 to 55 years of age will be part of the crucial trials. Healthy participants with no comorbidities and without a history of COVID-19 will be selected. People only from Delhi NCR will be able to take up the trial. Corona as well as liver test will be undertaken before the trial. 2 doses of the vaccine will be given and there will be a gap of 2 weeks between both the doses. The vaccine will be administered through injection. The emphasis will, however, remain on safety and screening, with ICMR scientists keeping a constant vigil on the scenario. With inputs from Nitendra Singh, News Night Desk, DD India.
Now, many